medplane.com. Medical talk made simple.
Mental disorders are some of the most common problems encountered during pregnancy and postnatal period. Women are not the only ones affected when they have mental disorders. Their babies and their families become adversely involved too. Most published studies focus on postpartum depression. However, increasing evidence shows that other mental disorders, such as personality disorders, eating disorders, post-traumatic stress disorder, and anxiety disorders, may also happen during and after pregnancy. There are two common types of depressive disorders seen during pregnancy and the post-delivery period: major depressive disorder and minor depression. In high-income countries, the prevalence rate of major depressive disorder in pregnancy is between 3.1 and 4.9%. Within the first 3 months after delivery, there's a 4.7% chance that a woman can have this problem, according to a study published by The Lancet. Minor depression may happen in 11% of pregnant women, and 13% may have it within 3 months postpartum. In low-income and middle-income countries, the prevalence rate of major and minor depression may go as high as 15.6% during pregnancy and about 20% within 3 months after delivery. Another study published by JAMA Psychiatry estimates that 33% of postpartum depression cases actually start in pregnancy and another 27% during the pre-pregnancy period. Most women who suffer from postpartum depression recover within a few months after the onset. However, about 30% of these women still have postpartum depression 1 year after giving birth. Per definition, major depressive disorder is having a depressed mood, diminished interest in any form of activity, significant weight loss or weight gain, insomnia or too much need of sleep, loss of energy, agitation, feeling of worthlessness or guilt, and recurrent thoughts of death and suicide every single day for at least 2 weeks. Mood symptoms may start during pregnancy or within 4 weeks after delivery. Minor depression, on the other hand, may have two of the key symptoms, like persistent sadness, loss of pleasure or interest, and fatigue, and also two associated symptoms of depression, like disturbed sleep, poor concentration, decreased or increased appetite, suicidal thoughts, low self-confidence, agitation, and guilt. Women suffering from minor depression experience these symptoms within 6 weeks after delivery. Anxiety disorder during pregnancy and after delivery is a common yet often overlooked mental problem. In the United States, 13% more women suffer from anxiety disorder during pregnancy and the postnatal period compared to their non-pregnant counterparts. Obsessive-compulsive disorder, a type of anxiety disorder characterized by unreasonable thoughts and fears resulting in repetitive behavior, has a significantly higher risk and prevalence during pregnancy and the postpartum period compared to its incidence during the non-pregnant state. Traumatic experiences during pregnancy and childbirth may trigger post-traumatic stress disorder, or PTSD, which is a mental disorder that results in flashbacks, severe anxiety, and nightmares. In high-income countries, the prevalence rate of PTSD during pregnancy and after delivery is 1 to 2%. Comparatively, the incidence of PTSD may be as high as 5.9% in low and middle-income countries. Women with eating disorders usually have infertility problems that may require fertility workup and treatment. Healthy weight gain during pregnancy is an accepted occurrence for most women. However, eating disorders may persist even during pregnancy in 29 to 78% of women. Binge eating, a serious eating disorder that results in the consumption of large amounts of food, is the most common form of eating disorder during the perinatal period. In fact, a Brazilian study published by the International Journal of Eating Disorders estimates that the prevalence rate of binge eating disorder to be as high as 17.3%. Sleep disruption and irregular mealtime schedules are the most common triggers for perinatal-related eating disorders. A Swedish study published by the Archives of Women's Mental Health states that about 6.4% of women develop personality disorders during pregnancy. In most cases, personality disorders are associated with other non-psychotic mental disorders like depression. The presence of these personality disorders may indicate adverse outcomes and poor response to treatment. Treatment options that don't involve any medications are of utmost importance to women suffering from mental disorders during pregnancy and after childbirth because of the concerns about fetal and infant health outcomes. Psychosocial and psychological intervention may play a role in reducing the depression symptoms within the first 5 years of pregnancy. This may be in the form of home visits and group sessions focusing on parenting, psychoeducation, maternal and child health, social support, and adoptive listening to the circumstances these affected women are living in. However, for other perinatal mental disorders, non-medical treatment options are still scarcely researched. Antidepressant medications play a mainstay pharmacological role for the treatment of non-psychotic mental disorders. These medications are also effective for the management of post-traumatic stress disorder, bulimia nervosa, which is a potentially life-threatening binge eating disorder, and also anxiety disorders. In the US, about 10% of pregnant women take antidepressants, mostly selective serotonin reuptake inhibitors, known as SSRIs, at some point in their pregnancy. This is in contrast to Europe, where there's only 3% of pregnant women who take these medications. Most women often stop taking antidepressants during pregnancy. Some clinicians believe that this discontinuation of antidepressant intake increases the risk for depression relapse. As a general principle, drug use during pregnancy should be minimized. Women with mental disorders during pregnancy and after child delivery should only receive non-pharmacological treatment. However, the use of medications should be reserved for more severe cases of mental disorders and disorders that may pose a risk to the mother and her baby.
Get the latest health news and info at medplane.com and hope to see you on Facebook and Twitter.